Hi, everybody. I'm here today with a very, very special guest.
Pardis Kelly.
Dr. Kelly is my podiatrist, and we're here today to talk about how diabetics should take care of their feet.
In the previous video, we talked with Dr. Kelly, our podiatrist, about how to take care of your feet if you have diabetes. In this video, she explains how to safely get a pedicure. It turns out there is a lot more to it than we thought, including a massively important warning about nail polish, which we share towards the end of the video.
What about pedicures?
That is part of the personal hygiene, cutting your toenails and looking at your feet for dry skin. And this can be done by the patient or by a family member or done professionally. Some of us can't reach our feet because we just can't do it because hip issues or lack of mobility, and you need to look for a place that is safe. And I need to emphasize the safety. Some patients, they qualify through their insurances, they can come to a podiatrist to have their nails trimmed and they have their exam and have the calluses shaved. But if you are a diabetic without really complication, good for you, but then again, your insurance may not cover, then you need to really vet these places where you go. There are rules for a pedicure. You got to make sure that you ask them, are you putting a disposable liner when you have the soaking done? Are these instruments being cleaned properly? Meaning that are they being sterilized in either a solution and or an autoclave? Most of my patients, they tell me, yes, my person is extremely clean. Everything comes in a pack. And I tell them that the pack is, at least in our office, when we pack our own surgical instruments, we put the instruments into a pack and the pack goes into an autoclave machine. And the color of the indicator changes as the pressure rises. So when we take the instrument out, we know it has reached the proper temperature to kill all the germs, including the fungus. But if you're not doing that, you're just putting things in a pack, you can have any instruments in a pack and open it up. That means nothing. What is it that you're doing with the pack?
So what would you look for?
You have to ask, why are you packing this? Is this a cold sterilization, meaning that was this put into a solution, or was this an autoclave? And if it is an autoclave, then there's an indicator that turns from a pink to black. And that's
on the pack itself?
That's on the pack itself. And then if it's a cold sterilization, then you understand, okay, how do you do it? Do you just hand wash it and then leave it in the solution for several minutes? Again, I know these questions or these answers that I'm giving you may not be on anybody's radar because we do trust that everybody's doing the right thing. But
not anymore.
You have to be an advocate for your own health. Another concern is you have to ask, are you seeing clients that they are high risk? Do you have enough training or understanding or self-education that shows that you understand what to do and what not to do? A good nail technician will know when to stop, because doing things can actually harm the person rather than helping them, although their intention is to help and not harm. So
I understand. So one of the issues I see with that is, and with all due respect, a lot of the manicure and pedicurists have difficulty with the language, English language.
Well, with today's world and apps, we have everything on our phone as far as translation. We can communicate. And so this is something that, again, you have to be an advocate for yourself if you're going to go there.
I understand. I'm just thinking back to my own experiences. I'm sure if I went into my normal manicure and pedicure person, whatever I ask, they're going to say yes.
Well, that's up to you. How you want to get the translation. Don't let it get lost in translation.
Okay.
So that is something that, again, it's important to for people with high risk. Let's put it this way. We have different demographics and different group of people and clients and patients, and not everybody's a high risk. But if you have diabetes, then you have to take that little extra step to say, okay, I have neuropathy. My sugar has not been under best control. I'm having difficulty getting the sugar down. This is definitely putting me at risk for not healing properly. Therefore, maybe I should just have my podiatrist take care of my feet. And there are a lot of podiatrists that they provide these services. And insurance allows, or even if the insurance doesn't allow, it is worth considering it, because then on the other end you don't have all sorts of complications that you would have to deal with.
One of the things that I noticed is you sent me immediately to what's known as a dry facility that doesn't do any, they don't soak your feet.
You mean the medical nail technician that I sent you?
I didn't even know they existed.
Well, there aren't that many. There aren't that many. And the reason I know that there aren't that many is because in my previous practice, I had a medical pedicure in my practice for 12 years. And I couldn't really secure any medical nail technician. I literally had to hire my nail technicians and then have them go through a course, educate them, and create a medical nail technician. And they're not as prevalent. You see them here, there, maybe one or two in every city or state. But these are nail technicians that they have been in practice for many years, and they have gone beyond their basic skills, and they have taken courses that it teaches them how to keep things sterile, how to do a diabetic patient or high risk client. They understand what to do, and more importantly, what not to do, and they recognize problems, and then they refer to the appropriate doctors for the issues.
So I'm sorry, do they actually interact with you? If they
Yes,
have a client?
Absolutely. So I have connected with one here in Nevada, in Vegas. She has my number and I have her number, and she has texted me pictures. And this also happened in the Bay Area when I practiced previously. They ask for my advice. I look and I go, I think this is something that you need to be not touching it, or yes, you can go ahead and do it. So yes, there is absolute communication.
Okay.
So,
and I can attest, Valencia is very good.
She's fantastic. Yes. That's why I send a lot of patients to her. She has gained my trust over the years. And so, she does no harm to my patients.
So if possible, find yourself a pedicure. Is it just personal preference how often you go to a pedicure again?
I would say it is. If you go to a podiatrist, your Medicare insurance allows every 61 days. But if you are going to a medical pedicure and you enjoy the services, you can go as often as you like. But again, also understanding a good medical nail technician knows that the person is coming for just maybe the massage or a little bit of a scrub, or and then the nails don't have to be cut shorter and shorter and shorter every time. So you got to be careful with it, because they feel like they have to do something. And
there's usually no issue there with sterilization.
With a podiatry, you don't have to worry about that because everything gets sterilized. But with a medical nail technician, it's a question that you still have to ask.
Oh, it is? Okay.
Of course.
That's my question.
Yes, of course.
Okay. What about nail polish? Is it safe to polish on your toes after they've been cut?
This is a very interesting topic, nail polish. Like I said, I had a medical pedicure in my practice for 12 years. Initially, I had set up all the protocols to make sure that there was absolutely no problem. And then yet I saw these white discolorations on the toenails after the removal of the nail polish. And most people, they think, oh, this is just a residue from the nail polish, or this is what some of the nail technicians is calcification, which does not make sense. Logically does not make sense. And if you show it to any podiatrist or dermatologist, they will tell you it's called white superficial fungus.
Oh.
So that is a fungus that grows between the nail polish and the top of the nail. And that's basically stays there. And if you keep ignoring that, that white stuff will eventually encroaches the nail bed. Nail will fall off like a loose tooth, and the nail bed gets fungus. So why am I bringing this up? Because when you do use a nail polish, first of all, think about it. If I have fungus and I like a red nail polish and you go right after me and you pick the same nail polish, there is a possibility of a contamination. Okay?
Ouch.
So that's one. The second thing is not all nail polishes are created equally. And I know this, and I can speak to you as an expert because I literally have a patent on a nail polish. This is a nail polish that we worked on for several years, formulated with the antifungal ingredient. And the reason we created it was because most nail polishes have chemicals that corrode the nails. And what it does is it creates etches in the nail plate. And so if there's a little bit of a introduction to with fungus will set sharp, and it will do. So
Wow.
if you say nail polish is safe, I wouldn't be able to tell you yes or no, because again, I don't know if it's a contaminated product. I don't know if this is a nail polish that has a lot of chemicals in it. This is for the consumer to figure out.
Is that nail polish that you patented available?
It was until a few months ago. I had it on Amazon. They have put it on pause for the time being, so I can bring it back to the market in the future. And it's called PS Polish, PS Cosmeceutical. There is a bottle there, and this is the polish basically. It comes in different colors, but like I said, it is not available on Amazon just because of just had to pause it for the time being.
Well, if it ever comes back on, let us know, and we'll put a link to it in this video. If you find this information useful, give us a like, subscribe to the channel, and tell your friends about us.